Hi, welcome to the Nurse Coach Duo. In this episode, we're talking about something many people experience but often struggle to put into words. It's that feeling that the life you've been living no longer fits, and the uncertainty that comes with figuring out what's next. Whether it's menopause, cancer treatment, divorce, becoming an empty nester, or another major life transition, these experiences often share common themes. On the other side of it, we often find ourselves facing new versions of who we are and wondering how to move forward. Joining us to discuss how to navigate these shifts is Erika Gomez. She's a registered nurse, board certified nurse coach, and a founder of Inner Rising Coaching. After witnessing the care her mother received during cancer treatment, Erika made a promise to give back the kind of support her family experienced during one of the most difficult seasons. Her nursing career spans surgical and gynecological oncology, oncology care coordination, and public school nursing, giving her a unique perspective on both the challenges people face and the resilience they carry with them. Today, Erica supports clients through one-on-one coaching and group coaching, helping them move through identity shifts, reconnect with themselves, and create lives that feel more aligned with who they truly are. Her work is rooted in professional experience, personal transformation, and a deep belief that support matters not only during life's hardest moments, but also in the process of discovering who we become afterwards. In this conversation, we explore what happens when stress is really a sign of something deeper, why so many people feel disconnected from themselves after years of meeting everyone else's expectations, and how small intentional changes can create meaningful transformation. I hope you'll find a lot of wisdom, encouragement, and hope in this discussion. Before we dive in, just a quick reminder. This episode is for educational purposes only and isn't medical advice. If you're dealing with a health issue, please check in with your healthcare provider.
Hi, welcome to the Nurse Coach Duo. My name is Angie McGuire. I'm a board certified nurse coach out of Oak Park, Illinois.
And hi, I'm Jen Schroer, owner of Clarity Health and Wellness Coaching. And today we have Erika Gomez with us, who is also a nurse coach. So we are the Nurse Coach Trio, which is always fun.
Yay.
Welcome, Erika.
Hi, good morning.
Good
Welcome. Thank you
morning.
so much for having me.
Yeah, we're super excited. We love bringing nurse coaches on. We love sharing with our community what nurses are out there doing. And, we're not just at the bedside. We're not just in doctors' offices. We're doing some amazing things for healthcare. And I believe changing the paradigm of healthcare and, where it's going right now I have so much hope. And I think that nurses are going to be, right at the forefront of that. So we'd love to just kind of start where we always start with our nurse coaches, kind of a little bit of why nurse coaching for you, what brought you into it, and if you want to talk a little bit about why transitions have, like your focus on transitions in life, where that came from, and just give us a little background.
Yeah, sure. Thank you.
Yeah.
So, why nurse coaching? For me, nurse coaching evolved naturally. It's something as nurses we do coach our patients in addition to helping them with medications and processing what's going on and teaching. There's a great element of coaching that happens. But why did I go into this specifically? It's because I'm so clear on my why.
Mhm.
I have such clarity with it. My background, nursing was not my initial choice after high school. I was actually pursuing a career in the arts entertainment industry. And, life happens. And I had a major turning event in life where my father unexpectedly passed away. And shortly after, my mom was diagnosed with breast cancer. Fast forward after she completed her treatment, went into survivorship, I felt an incredibly strong pull to return to others what was given to me. I felt, you know what, a fruit basket isn't enough for the medical staff. It was such a rippling effect, not just for my mom, but for myself, the family. And that's when I said, I am going back to school. I'm going to study nursing and I'm going to work with oncology patients and give back what was given to us. And that I felt it was a spiritual calling. And that's what led me into nursing and specifically into oncology.
And can you tell us a little bit the journey then to become a nurse coach? How did you find
Yes.
nurse coaching?
Yeah, so with nurse coaching, fast forward, I fell into the burnout space like many nurses do, and I found myself navigating a personal transformation. It took a while. It was, several years of questioning, what do I do? I feel really burned out. In between the oncology, I did work as a school nurse again and then returned back into the oncology space. But a part of me felt that, our traditional healthcare system, we're always, we're serving patients, but there isn't enough time to really sit there and connect with your patients and really help them in the in what we're taught theory in nursing. And I felt I wasn't really serving the purpose that I initially entered the space for. And in that search, trying to figure out my next steps, I did a Google search, which I've done for over a year, trying to figure out, well, what do I do? At one point, I was a massage therapist as well prior to nursing, but I've always been in that space of helping others, serving, but I just couldn't find, well, what can I do in nursing that allows me to do that? Every search led into another modality in nursing that was clinical heavy. But somehow the universe just led me to nurse coaching, a Google search. And when I read what nurse coaching is, I said, that is exactly what I want to do. And I learned to release fear, learned to let go of the comfort level, and stepped into a space where I wasn't sure what the next steps were going to look like, but I went full force into it. And I turned in my resignation. I enrolled into a nurse coaching program, resigned from my last clinical position, spent 3 months in Italy studying, but also nurturing myself. And I took my mom with me on that trip and fulfilled the dream of taking her overseas as well. She's 84. And it was an incredible gift that I gave myself. And fast forward, I returned back to Texas and opened my business. And here I am embracing a chapter that has been incredibly fulfilling in serving others at the capacity that I initially meant to do this
Yeah.
as a nurse.
Yeah. Oh, that's fantastic. I love just listening to that kind of the breadcrumbs that brought you there, right? Like I think that we find a lot of the nurse coaches they were just seeking more, right? Like you can only give so much of yourself and not feel like you're fulfilling yourself, right? And fulfilling the practice that you want to do for your patients. And yes, some of us leave bedside, some of us are able to take that and stay at the bedside. So I think that's it's a really great thing that as nurses, we have so many options of what we can do. Like you said, like you can Google all day long and there's going to be yet another thing that we nurses can do. So thank you for sharing that. It's a beautiful story. A little eat, pray, love there for today. So tell me a little bit about, with going into the nurse coaching, what drew you to really working through like life transitions? I know you've worked with people within multiple different types of life transitions, and right now I think you're focusing more on the cancer transition of post treatment. But what drew you kind of to that personal change transition spot as that's where you really wanted to focus your practice in?
Because I know I've lived the that space where a major life event can really shift your identity and leave you questioning, who am I? What is my purpose? And that was a very impactful point in my life. And I am so clear on what my purpose is. I just couldn't really put my finger on it early on as I was navigating life, but I've always gravitated, I've always felt a strong pull to help people who are looking to reconnect with themselves, who are in need of finding direction, and in spite of having a major life turning event shift their identity. And so that's really what brought me to this space. That's my why.
Yeah. Gosh. I mean, I love that you have your why and you're like some conviction around it, right?
Yeah.
That's awesome when you have that sort of the vision and you speak about purpose, and that's obviously so important and something we talk about with our clients all the time, finding that purpose and where, and it's a good place to start, right? When you talked about your turning point or um and that what was so impactful to you when your dad passed away and had to move forward. What are some common like transitions or turning points that you with your clients? What are the most common, would you say?
I think when you're just kind of navigating life and you get caught up in feeling overwhelmed because they have this concept of I need to do something big. Whatever I'm trying to navigate, I need to have all of the answers up front. It needs to be something huge. And, one thing that I really stress is let's dial back. Let's dial back for a second. First, you don't need to have all of the answers right up front. You just have to start with one tiny step. But also, I'm really big on focusing on the here and now. I know it sounds so cliche, but when you focus on the present moment, just the little things that are right in front of you. The reality is yesterday and tomorrow does not exist, right? We have the moment right here. And it helps to remove a lot of that burden off of your shoulders, a lot of the worrying, a lot of the anxiety. So I think just being a little bit more focused, more intentional on the here and now. So that's one thing that I see huge in clients. They come in feeling so overwhelmed because we have a sense of, I need to have everything figured out. What am I doing? So just dialing things back and just being a little bit more intentional, a little bit more focused on the present.
Yeah. Well, and you've talked a bit about stress and burnout, and even in your own life, and I'm sure you see that. I mean, we see with all of our clients, right? Like, I mean, at the end of the day, I think that even though we mostly work with women in perimenopause and menopause, and it's a very stressful event in our bodies, like everyone is dealing with so much stress that it's just that's everybody could use some help with that, right? So there's no question that, when we have clients come in that there is a piece of stress. So how do you kind of help them identify the difference between what's just stress and what's an actual like deeper identity shift where you're talking about where like, I mean, some people might just not really understand that that's what that is. So I'm just curious how you pull that out from someone to figure out whether is this stress, is this burnout, or is this truly I need it. I'm shifting my thought process into who I am. I know that as a perimenopausal woman, I went through that.
Mhm.
There's very much a who the heck am I now feeling at times. So I'd love to hear a little bit about how you kind of help people pull that out and understand that.
So understanding the difference between stress and burnout. Well,
Well,
stress.
just the difference of like what's like how you help them navigate a true identity shift, right? Because we could just be stressed and be burnt
Mhm,
out, but it's not a true identity shift.
mhm. Well, I would say just thinking back on burnout, for example. Burnout is when you have that repeated exposure to that stressor and there's a point where you break. You're like a total and a lot of nurses can relate to this. You're constantly exposed to stressors, whether it's scheduling, your patient load, life events, all of this, and suddenly there's a point where you can't take it anymore. So just helping patients or clients to understand, when it comes to identity shifts, burnout, stressors are things that we're exposed to. We can help with deep breathing techniques, step away for a moment. Burnout is the repeated exposure of that stressor. And identity shifts would be, if they're questioning more, well, who am I? Who am I? I feel I am not, for example, living my full purpose. I don't recognize who I am anymore. Um, I feel unfulfilled. I feel there's something that's not complete. So I think that sort of explains the differences between what's going
Yeah.
on. Stressors, we can control those. It's all based on, whether we need to remove ourselves from it or implement some skills, some deep breathing techniques just to help reset our mind, just help calm ourselves in the moment. But as far as deep identity shifts, there's a lot of questioning. There's a lot of who am I? Am I fulfilling what I'm meant to fulfill? So those are, some of the questions that come up, especially when they wake you up at 3 or 4 in the morning. And these are thoughts that are repetitive thoughts. You're constantly questioning. That's a sign. And you know what? That's actually a beautiful thing because it means that you are entering a season of growth.
Mm.
So yes,
It's really
that's
interesting the feedback that we get from our audience on that because Erica, so we work with primarily women in midlife that are waking up at 3 and 4 in the morning
So,
due to more of a hormonal shift. But then the worry but I do love the idea that it is time of growth and it can be a time of growth, certainly. So it's kind of it's a nice mind shift about about waking up in the middle of the night. It always feels a bit overwhelming. So I think I'd love, what to do at that time in the morning, what to do to actually, go back to sleep or make change, right? Or identify what we're wanting to focus on. From, hearing about what you do, and I love also, I want to go back to the here and now also resonates with me and would our clients as well, because, we talk about pausing a lot. And obviously we work with people, women in perimenopause and menopause, and it is a great time to pause, right? And pause and, like you said, sit back and evaluate and, seek out help, seek out a coach, seek out, and it is transition, but a time of pause too. And I think it's just really important to talk about that and how important that is to actually pause and think about right now, where we are and not yesterday and tomorrow, like you said. So I love that, those thoughts. And, so when you talk about working with your clients and making like one intentional shift, actually tell us a little bit about how you get there with your clients. Like, how do you identify? I mean, you've mentioned a lot of reasons why your clients are coming to you, right? Burnout and, what you've already mentioned. But identifying, how do you get a person or a client to identify that one thing? Where to start? Where's the starting point?
Well, so when we were discussing identity shifts and I hear a lot of, who am I? I don't feel like myself anymore. Well, the first question is, can you describe your old self? Who is that person?
mm.
And what is it you're hoping to become? And so bridging, figuring out or having them describe who they felt they were before, who they want to become, and we're gonna bridge that gap. And, I always feel that we still have elements of our old self. Our old self isn't completely removed. But, that's usually, and that's when I encourage them, what you're experiencing is absolutely normal. That is, we're going to figure out. So just asking questions. Sometimes I notice people are avoiding something that they know they need to address and face, but by asking the deeper questions, repeating it back to them, having them hear what they're saying. And, a lot of times I see that light bulb, I see that sense of hope, I see that sense of, okay, you know what? I do still feel elements of the old me, but there is a new me that's blossoming, and I want to work towards that new person, that new me. So
Mm.
it's just really the starting point is describe the old you. Who are you? Who do you think you were before? Let's start there.
Yeah. So I think that I mean, when I'm hearing, it's just so funny how this just fits like right into like this transition, this change, what have you, because there is so much of the old you that you are no longer feeling that you are the old you. So there is a time that you need to look into like who do I want to become? Who am I okay becoming? But it's also some acceptance in there, right? Of this change is happening and setting some boundaries and accept, and communicating with other people. And it's such a big thing when you have this identity shift and when you become this other person because everyone expects you to be who you used to be. And that's not who you want to be anymore because it doesn't feel right. So, can you talk a little bit about how you help or what you've seen, even maybe you've seen just experiences of what you've seen, but how do you get people to into that acceptance? Because there's a lot of resistance, right? Well, but I was this person, but I want to still be that person, but that's what people expect from me. And so there's some resistance. And so how do you get them into accepting and allowing themselves to become this new version of themselves?
You know, it's just learning how to release that pressure off of yourself, and just taking the small steps to do that. And well, why do they feel a sense of obligation to be
Mm.
who they feel others need them to be? Why are we giving that power to others? Why are we not giving the power to ourselves to be who we authentically feel we are becoming or who we want to become? And again, it's just learning little techniques to help set boundaries. And but the whole thing is we focus, my focus is on the person, figuring out what are their strengths, helping them see what their strengths are. If there's any areas that we need to build, then we will work on building those areas. But I think learning to set boundaries is absolutely essential. Absolutely. Sometimes we give too much power to others.
I think, we talked a little bit about, before we started the interview, about caregivers, right? And I know you work with caregivers, and I think many of our listeners, women in midlife, we are caregivers, whether you're a nurse or not. How do you, when you can't set boundaries, right? There's times of our lives that we can't set boundaries. And so, is it little daily, is it little moments that we can check in with ourselves? Is it breath work? Is it, little notes to ourselves that we are awesome? No, as caregivers, it's just such an important, um, there's got to be, how do you work with your clients that are caregivers and especially caregivers? Some,
Well,
points there.
yes, no, absolutely. I mean, I'm there. That's my life as well. I have my mom. She's amazing. She will be 85, actually 86 this year. So I can relate to that. As far as caregiving, it can be incredibly hard. Finding it may be hard to set boundaries, but I think learning to recognize that we may not have control over events around us, but we do have control over how we interpret these events and how we allow events to affect us. And I know it's easier said than done initially, but by taking little steps to help build that strength. And yes, if there's a moment where you're incredibly overwhelmed, step away, step away, step away, give yourself some time. And I know it sounds so incredibly simple, do the breath work and the deep breathing, but it is so incredibly effective. It is really effective to just step away, give yourself some grace, do some deep breathing. And that's something that I found myself doing as well. Sometimes when you're in a moment where you're overwhelmed, I step away. I step away, I go to the bathroom and I just pause and I take a few deep breaths, take some fresh air, come back. I talk to myself. I tell myself, you don't have full control over the circumstances around you, but it's reframing, looking at this as a gift, as a privilege, to be able to assist, especially a loved one. And just learning to be more present in the moment. And again, I really stress that because when you are, it helps you to really see the moment as really a gift, and it's not forever. And just learning to understand that you may not have full control of your circumstances. I'll give another example. Recently we lost our family pet, and she was with us for 14 years. I I realized something that, I was caught up and overwhelmed. She was ill. She was crying that or meowing the day before she passed, and I was so caught up in my day-to-day, just really busy, and felt a bit overwhelmed, by her crying or meowing. The following day, when we realized that she was, actively transitioning, we spent time with her, embraced her, told her how much we loved her, thanked her for her time with us, and told her it's okay to go. And when she transitioned, I had some time to reflect on that. And it made me really realize that being present, just being in the moment is really where I find the most peace. And
Mm.
again, you don't have full control over events around you, but you do have control over how you choose to manage it, how you interpret it. And for me, it's finding that element of peace, even amongst a moment of chaos or major overwhelm, and just learning to focus on what I need for myself. And sometimes, like I said, it's just stepping away and taking a few deep breaths to center myself.
Yeah, it's amazing, just to remember that a breath, it doesn't have to be sitting down for 20 minutes and meditating. A simple breath can do so much. And I feel like what I'm hearing whenever you talk is a lot of permission giving, right? Especially to caregivers, but also to people like, life transitions, how, whatever. You're giving them permission to do the things that they need to do for themselves. It's not selfishness. We hear that all the time. I literally had a client the other day that said that she can't exercise because that's selfish. She has to be giving that time to other people and to other things. And it's she would never think that of anyone else, but for herself, that was too selfish to do. So I do hear, and I feel in coaching often, there's a lot of permission giving, and people need to hear it from someone else that it's okay for them to follow their own dreams, to follow their own path. So, but what I'm also hearing, and I'd love to get your kind of input on what you do versus therapy, right? So we have a very fine line that we walk as nurse coaches because we do get into a lot of things that are deep, right? And it going deep is what's going to help people heal. So Angie and I talk all the time about it takes a village. It absolutely, and we resource out to all kinds of people, therapists, personal trainers, what have you, doctors to do labs, all these kind of things. If you could talk a little bit about where your line is there and like what you see as the difference between your coaching and maybe therapy.
Yes, absolutely. And that's a great question. A lot of people aren't really clear on the difference. And
Right.
so with therapy, that space is most appropriate for people who are still trying to process past events. They're still trying to, there's a lot of questions, a lot of whys, and um, they're needing to process that of traumas. However, with coaching, that space is most appropriate for people who are ready to step forward.
Hmm.
They're looking ahead. They're not quite sure, perhaps, how to navigate that. There's some uncertainty on what the first steps entail, whether they need to have all of the answers right away. But that's most appropriate for that setting of people. So, past events, counseling, figuring, processing, and for coaching, we're looking forward into the future, season of growth.
Yeah.
That's a simplified way for people who
Beautiful.
are
Yeah.
there.
Perfect.
Yeah, no, that was wonderful. Actually, Jen, I don't think we've ever had that actually in an
No,
interview, and so
no.
that's really I love your explanation, and it is clear when you were very clear, and I love that, and it's it's wonderful to find and work with people that are ready to move forward,
Yeah.
and you can work together with them to identify how they're going to do that, right? But I certainly have had not patients, clients that I have referred back to therapy too, that it just doesn't seem like they're ready, or they've really actually identified it and said, I'm not ready. So, how do you when people are feeling stuck, right? I mean, I know we're talking about we still get people as coaches that then get stuck, right? They take that first step, and how do you if someone's uncertain about how to move forward, like what's your best motivational tips, and how do you get people moving? How do you get people moving.
Yeah, no, great. That's, the first thing is trying to figure out, well, what is stuck? What does that mean really? Are we stuck? Are we not able to move forward because there's an emotional block? Is it an internal conflict? Are we stuck because we're overwhelmed? What exactly? I ask them, define what you're feeling, what's going on. Sometimes it's as simple as, well, I have all of these things I'd like to do. I just don't know which one is first. Okay, great. Let's talk about that. Or other times it's, we are just ruminating on something over and over again, whether it's guilt. So it's figuring out exactly having them define what are you feeling? Let's start with that. Let's just dial back. What is it that's on your mind? And and actually, that's a great question because based on that, we can figure out also, is coaching really appropriate,
Mhm.
or do we need to address some things? Is therapy the way that we need to go? Sometimes being stuck can be they're really dealing with unresolved past issues. And if that's the case, then let's explore that a little bit deeper and figure out, well, perhaps we need to address this. Counseling is probably most appropriate at this time. But yes, just finding out what stuck means. I know it's such a general word, but just
Yeah.
asking the right questions. And sometimes it can be, there's something a little bit, something that we know already that we need to address, but we haven't quite brought that forward. And yeah, just asking the questions, just to basic questions, define that. What does that look like? What does that sound like? So yeah, there's
Yeah.
a lot, the emotional, or it can be things that we're avoiding. So yeah.
Mm. Yeah, definitely. I was like, oh yeah, I'm waiting. I think we all do that, right?
Yeah.
Um, yeah, often it is, right? You just, if you can get the right questions and kind of get them thinking beyond themselves, it removes those roadblocks, removes those blinders, and you can really find something with just a few simple questions that is like, oh my gosh, that's my why, or that's my bridge, or that's my what have you. So I think that's great. I love that. Just kind of wrapping this up and putting it into the theme of the season of growth, I really love that. Um, if you had one piece of advice for people going through transitions that are finding themselves kind of at a crossroads, that they are at an identity shift, and how they can look at it more as a season of growth versus, just this like trauma or horrible thing that is going on. Like what would your advice be to somebody who's kind of starting to approach that phase in life, if you want to call it a phase?
Yes, no, it's okay. It's okay. And embrace that it's a beautiful thing, because when you find yourself questioning and you're feeling all of these emotions, you're feeling, oh, I just don't know what's going on. I'm not sure. There's a lot of uncertainty. It's a season of growth. Recognize it as what that is. And rest assured you do have the answers within. You do. However, sometimes it may take a long time to get there because you are stuck. You might be stuck at a certain point and you just don't know how to propel forward right away. And what I tell a lot of people, again, just to sort of simplify it and explain it a little bit more clearly, you can sign up and go to the gym. You look at all the machines and you can pick one and start working out. That's great. You don't quite have a plan. You're gonna try this one, try the one for biceps or legs, and just kind of give it a go. Or you can hire a personal trainer, someone who is going to guide you, who's going to give you a workout plan, who's going to figure out first, what are your goals? What are you trying to achieve? Are you looking to do this for health, general wellness? Is it more for aesthetics? Are you looking to compete? What is it? What is your goal exactly? Well, based on your goal, let's work on a plan together. These are the recommendations. These are the tools. At the end of the day, you're still doing the heavy lifting. You're still showing up. You're still doing all the work. You have it within you to do it. But
Yeah.
when you work with someone who has the experience, who has worked with others, they can give you the guidance, and you can get there a whole lot faster and a whole lot further with the assistance. And so, I just want listeners to know you have the answers within you. Working with a coach will help you get there a whole lot faster, perhaps in a safe environment where you are able to just be yourself. You'll have someone who will hold you accountable, who will be your guide, who will be your cheerleader, who will
Mhm.
help celebrate wins with you, who will help you recognize where the areas that you need perhaps to spend a little bit more time. And but do know you do have it within you. Absolutely. And my goal always with people is not to depend on me forever. We're going to work on this together. It's a partnership. We're collaborating together, but at the end of the day, you have it within you. Absolutely. I have faith in you.
I feel like there should just be a mic drop.
I was thinking the same thing. That's so funny.
Yeah, let's end it there
Yeah.
because that was amazing, Erica. We need to shout this from the mountaintop, right? About nurse coaching and I love how you've explained it and our the passion is like coming out of you, which is awesome. So yeah, I think one of my favorite things about being a coach, nurse coach is just being that partner, like you said. I mean, you've identified a lot of all the stuff that we do, but I love like being their accountability partner or I just that's part of what everyone needs that. And we find it in different people, colleagues or but it's so important to have that and especially when you're stuck like you said.
Yeah.
So well, this has been awesome. Thank you so much. I mean,
Yeah.
I'm so excited for you and your practice as a nurse coach and all the clients that you will help move forward and work with. It's awesome. So, thank you for being with us. Thank you for your time
Thank
today.
you.
And yeah, and to our audience, if you liked this episode, please give us a like and share it. And if you're a nurse coach, you better share this with your clients, your people, because it explains a lot of what we do. So, thank you very much, Erica, for being here.
Well, thank you for having me and thank you for creating the space for nurse coaches. Thank you.
Absolutely. Thank you.